Have you ever looked at a bowl of mixed nuts and wondered if one tiny choice could actually make a difference for your prostate? It sounds almost too simple, doesn't it? Many men are told that prostate enlargement is just something they have to live with as they get older. While aging certainly plays a role, what you eat every day can also influence your overall prostate health in ways that often surprise people. And today, I want to talk about one particular nut that has earned attention from both researchers and urologists, not because it's a miracle food, but because it contains nutrients that may help support a healthier prostate as part of an overall healthy lifestyle. My name is Dr. Narita, and for the past 16 years, I've had the privilege of helping thousands of older men better understand their health, confidence, and quality of life. I spend my days caring for men who are concerned about frequent bathroom trips, interrupted sleep, and the changes that often come with getting older. My goal today is to help you understand the science in a simple, practical way, so you can make informed choices without false promises or unnecessary worry. Before we continue, if you enjoy straightforward men's health advice, I'd love for you to like this video and subscribe to the channel. And I'd also like to hear from you in the comments. What's one healthy habit you've started in the past year that's made you feel better? Your experience might encourage someone else. Now, let's talk about the nut that often surprises people. The Brazil nut. At first glance, it doesn't seem very special. It's larger than most nuts, has a rich, buttery taste, and many people only eat it around the holidays. But inside that single nut is an impressive amount of selenium, a mineral your body needs in very small amounts. Selenium acts like part of your body's maintenance crew. It helps protect cells from everyday damage caused by normal metabolism and environmental stress. Why does that matter for your prostate? Think of your prostate as a hard-working piece of machinery. Over many years, it experiences wear and tear, just like the engine in a trusted pickup truck. Your body has built-in systems that help repair and protect tissues, and selenium plays a role in supporting those systems. While eating Brazil nuts won't shrink an enlarged prostate or replace medical treatment, getting enough selenium may help support overall prostate health when combined with a balanced diet and healthy lifestyle. This is one reason respected organizations like the National Institutes of Health emphasize the importance of getting essential nutrients from food whenever possible. The key is balance, not excess. And that's where many people make their first mistake. Some men hear that selenium is good for the prostate and immediately think, if one is good, 5 must be even better. Unfortunately, that's not how the body works. Brazil nuts contain so much selenium that just one nut can provide close to, or even more than, the recommended daily amount depending on its size and where it was grown. Eating several every day for long periods could actually give you too much selenium, which isn't healthy either. So instead of thinking bigger is better, think smarter is better. One Brazil nut every now and then, or following your healthcare provider's advice, is generally a much safer approach than treating it like a supplement you can eat by the handful. But here's something even more important. Many men become so focused on finding one superfood that they overlook the real reason their prostate continues to give them trouble. Imagine trying to keep a garden healthy by watering only one flower while ignoring the rest of the soil. It simply doesn't work that way. Your prostate responds to your overall health. Blood sugar, body weight, physical activity, sleep, hydration, and inflammation throughout the body can all play a role in how you feel over time. That's why two men with similar prostate size may experience very different symptoms. I've had patients who were disappointed because they tried one trendy food for a few weeks and expected dramatic changes. Then we stepped back and looked at the bigger picture. Together, we improved their eating habits, encouraged regular walks, reduced late-night caffeine, and helped them manage their weight. Over time, many noticed they were sleeping better, waking up fewer times during the night, and feeling more in control. Not because of one magical ingredient, but because several healthy habits started working together. And speaking of healthy habits, there's another nutrient that often gets even less attention than selenium, yet it may have an important relationship with prostate health. Most men don't realize they're not getting enough of it, and that's exactly what we'll explore next. Many men are surprised to learn that zinc is another mineral closely connected to prostate health. In fact, the prostate naturally contains more zinc than many other tissues in the body. Researchers are still studying exactly how zinc supports normal prostate function, but they know it plays a role in healthy cell activity, immune function, and tissue maintenance. The challenge is that our bodies don't store large amounts of zinc, so we need a steady supply through our diet. Foods like lean beef, oysters, pumpkin seeds, beans, and nuts can all contribute. This doesn't mean you should start taking high-dose zinc supplements on your own. In fact, taking too much zinc for long periods may interfere with the absorption of other important minerals, such as copper. Balance is always the goal. Think of your body like a well-managed workshop. Every tool has a purpose. If one worker starts taking over everyone else's job, the whole workshop becomes less efficient. Nutrients work in much the same way. They perform best when they're in the right amounts and working together. This is one reason I encourage my patients to focus first on building a colorful, varied plate instead of chasing individual nutrients. A handful of vegetables, whole grains, healthy fats, lean protein, fruit, and a few nuts throughout the week often provides far more long-term value than relying on expensive supplements with big promises. There's another habit that quietly affects the prostate, and it's something many men overlook because it doesn't seem connected at first. Let's talk about movement. When men retire, it's common for daily activity to decrease without even realizing it. The morning commute disappears. There are fewer stairs to climb. More hours are spent sitting, watching television, reading, or using a computer. While relaxation is important, our bodies are designed to move. Imagine a river that flows freely. The water stays fresh and clear. But if the water becomes stagnant, problems begin to develop. Your circulation works in a similar way. Regular movement helps support healthy blood flow throughout the body, including the pelvic area. Healthy circulation doesn't guarantee relief from prostate symptoms, but it supports the tissues that depend on oxygen and nutrients. Even a simple 20 to 30-minute walk, most days of the week, can benefit your heart, blood vessels, weight, blood sugar, and overall well-being. Those same improvements often have positive effects on urinary health as well. I've seen men who believed they needed an intense exercise program, only to become discouraged after a few days. The truth is, consistency usually matters far more than intensity. A daily walk after dinner, gentle stretching, or light strength exercises performed regularly can be much easier to maintain. Now, here's a common misconception that deserves attention. Many men think drinking less water will solve frequent urination. It seems logical. If less liquid goes in, fewer trips to the bathroom should follow. But that's not always what happens. When you're dehydrated, your urine becomes more concentrated. That concentrated urine can sometimes irritate the bladder, making urgency and discomfort feel even worse. Instead of severely limiting fluids, many urologists recommend drinking enough water during the day while reducing large amounts of fluid close to bedtime if nighttime urination is a problem. It's a simple adjustment that may help some men sleep more comfortably without becoming dehydrated. Caffeine and alcohol deserve a mention here too. For some men, especially later in the day, these drinks may increase bladder irritation and make nighttime bathroom visits more frequent. That doesn't mean everyone must eliminate them completely. It means paying attention to how your own body responds. Your body often gives you useful clues if you're willing to notice them. This brings us to another question I hear almost every week. If my prostate is getting bigger, does that automatically mean I have prostate cancer? The answer is no. An enlarged prostate, also called benign prostatic hyperplasia or BPH, is very common as men age and is not the same thing as prostate cancer. Although both involve the prostate gland, they are different conditions with different causes and treatments. That's why regular checkups are so important. Your healthcare provider can help determine what's causing your symptoms and whether additional testing is appropriate. Organizations like the American Urological Association and Mayo Clinic continue to emphasize that men should never ignore persistent urinary symptoms. Difficulty starting urination, a weak stream, frequent nighttime urination, or the feeling that the bladder isn't completely empty all deserve a conversation with a healthcare professional. Early evaluation doesn't always lead to medication or surgery. Sometimes it simply provides reassurance and helps you choose the most appropriate next steps. Before we move on, there's one final piece of the